Greetings to nursing students, to your families and friends, to your faculty and deans on this very special occasion. I'm Dr. Lorraine Frazier, Dean of Columbia University School of Nursing and a trustee of the Arnold P. Gold Foundation. The Gold Foundation created this ceremony in 1993 to mark this moment in your journey, to emphasize the critical importance of humanism in your care of patients.
The Gold Foundation defines humanism as compassionate, collaborative, and scientifically excellent care, which is the very foundation of all of our work as nurses. I'm Dr. Kelly Bryant, Assistant Dean of Clinical Affairs and Simulation at Columbia School of Nursing. Today we will be introducing a special keynote address for you.
Today, you will recite an oath to patient care or invoke a powerful symbol such as lamplighting to recognize this awesome responsibility. You will pledge not only to navigate the complex metrics and diagnostic standards as best as you can, but just as importantly, to be human. To leave your patients and colleagues better off because you listened, you cared, you were present with them with compassion. Throughout your training and career, you will also be met with opportunities to innovate. As nurses, we have access to more advanced technology than ever before. You will have an opportunity to ensure that these remarkable tools help strengthen the connection we have with patients and the very care that we give.
Your ceremony today takes on an even deeper meaning as our planet continues to grapple with the COVID-19 pandemic and terrible and persistent racial inequities. Your role as a nurse will be meaningful within both realms. You will have a far-reaching impact on patients and their care and how we ensure as a society that healthcare is accessible and equitable for all people. In this historical context, we are honored to have Dr. Deborah Troutman present the 2021 Nursing White Coat Oath Ceremony Keynote Address.
Dr. Troutman is President and Chief Executive Officer of the American Association of Colleges of Nursing, known as AACN. As the national voice for baccalaureate and graduate nursing education, AACN serves the public interest by setting standards, providing resources, and developing the leadership capacity of member schools to advance nursing education, research, and practice. Dr. Troutman has been a steadfast leader for humanism and helping to ensure that it is incorporated as part of the standards in nursing education, research, and practice. We know that your school, which is hosting this very ceremony, also values humanism in nursing, as we do here at Columbia.
Prior to AACN, Dr. Troutman served as the Executive Director of the Center for Health Policy and Healthcare Transformation at Johns Hopkins Hospital. She has also served in other leadership positions at the Johns Hopkins Medical Institutions and the University of Pittsburgh Medical Center. She has authored publications on health policy, leadership, nursing practice, and nursing education. She has also served on many national boards and advisory groups, providing guidance to the National Academy of Medicine, the Department of Veterans Affairs, and the Robert Wood Johnson Foundation, among others. Dr. Troutman received her bachelor's from West Virginia Wesleyan College, a master's from the University of Pittsburgh, and her PhD in health policy from the University of Maryland, Baltimore County.
We are delighted to share her words of advice to you on this special day. Congratulations on your nursing journey, your story, and please join us in welcoming Dr. Deborah Troutman.
Hello, I'm Deb Troutman, President and Chief Executive Officer for the American Association of Colleges of Nursing. It's my honor to join you today to welcome you to today's ceremony. As we think about the White Coat Ceremony, and importantly, humanistic, compassionate care, I'd like to take a brief moment to reflect on the past, the present, and the future. When we think of the past, White coat ceremonies are not new in the health professions, but they are relatively new in nursing. In 2014, the American Association of Colleges of Nursing and the Arnold P. Gold Foundation formed a new partnership, a partnership to promote the importance of humanistic patient-centered care. Together, we realized and supported a commitment to spotlighting the importance of providing compassionate care among nursing students early in their professional formation. Then and now, the present, we shared a common definition of compassion. Compassion is the recognition, understanding, and emotional resonance with another's concerns, distress, pain, or suffering, coupled with a relational action to ameliorate these states. Simply stated, compassion involves having empathy or real concern for an individual in need, coupling that with a desire to take action to address the need. And when you see it, you know it. When you see compassionate care, you know it. There are 7 common attributes associated with compassionate care. They are integrity, and that's the congruence between our expressed values and behavior. Excellence, clinical expertise. Compassion, the awareness and acknowledgement of the suffering of another and a desire to relieve it. Altruism, the capacity to put the needs and interests of another ahead of our own. Respect, the regard for the autonomy and values of another person. Empathy, the ability to put oneself in another situation. And service, the sharing of one's talent, time, and resources with those in need. Dr. Patricia Benner, a nurse scientist, identified 4 hallmarks of compassionate healthcare. These hallmarks include a strong desire to help patients, families, and colleagues, the ability to collaborate and communicate and partner with patients and their family members to the extent they need and desire, a commitment to communicate and collaborate with all who provide and support healthcare. And 4th, but very importantly, well-being and resilience of the healthcare professional. Evidence shows a clear link between personal well-being and quality of care. Nursing then and nursing now. Pledging a commitment to providing compassionate care has the potential to transform the entire healthcare experience. It benefits the patient, the care team, and the individual provider. It's the right thing to do, and it raises quality. There's a growing body of evidence that demonstrates that caring, trusting, and collaborative relationships with patients lead to more appropriate healthcare decision-making, better adherence to treatment plans, and less costly healthcare outcomes. Employers are looking for highly educated nurses who can deliver these outcomes. So the pledge you make today will go a long way to ensuring a bright and rewarding career horizon for you. It's the right thing to do for the patient, it's the right thing to do for the patient's family, and it's the right thing to do for you. Now, before I share my last piece of advice, I want to share a personal reflection, one from early on in my career. Early in my career, as a practicing emergency department nurse, one of the very first times that I was on a team that was participating, or I thought I was going to be on a team participating on a resuscitation, I was working an evening shift when we received a notification from the paramedics that they were bringing in an elderly woman in cardiac arrest. When the paramedics arrived, indeed, the woman was in cardiac arrest. We transferred her to the resuscitation room, and as we were beginning the resuscitation, the charge nurse informed me that there were enough individuals in the room and that I could leave. I was very disappointed, but I left the room. And when I went out of the resuscitation area, I did notice that there was a gentleman sitting alone in the waiting room. So I went up to him and introduced myself as a nurse. And I learned that he indeed had accompanied the woman that was in cardiac arrest. He had accompanied her with the paramedics. I introduced myself again, as I said, as a nurse, and I asked him what he knew. And I explained to him that the team were doing all they could, that his wife's heart had stopped, and that we would keep him updated as to her ongoing care. He asked me if I would sit with him for a moment. So I sat down with him in the waiting room. It wasn't busy in the emergency department, which was unusual, but things were rather slow. So I sat down with him for a while, and he began to tell me some about he and his wife's life, that they had been married for over 50 years. And he shared several stories of some of the times that they had had together. It wasn't too long after I sat down, though, that the leader of the resuscitation team came out and informed them that, regrettably, despite other efforts, they were not able to restart her heart. As I got up to leave, he grabbed a hold of my hand and he asked me if I would accompany him when he went into the resuscitation room to say goodbye. So I went to the resuscitation room with him. He said goodbye to his wife, and then I helped him get into a taxi and get his transport home. I certainly felt sorry and sad for his loss. I had to begin my other duties in the emergency department to continue those duties. So I didn't think a lot more about the incident, but a few weeks later, I was reminded, because we received a thank you note in the emergency department, which is not usual to begin with, but he had taken the time to write a thank you note to the emergency department staff. And he began his thank you note by thanking the entire team for all that we had done to attempt to help his wife and to restart her heart. And although we were unsuccessful, he wanted to express his gratitude. He said in his note, "I would also like to thank that nurse that sat with me while we waited to see what was going to happen with my wife." He said, "I shared many stories with her, but there's one that I didn't tell her." And he said, "I'm going to write it now." And he wrote in his letter, "My wife and I knew that this moment would be inevitable. We were both in our 80s, and so we had begun to talk about it. I had said to my wife that I wanted to go first. And my wife asked me, recognizing, of course, that we have no control," he said in his note, "but my wife asked me, why was that? And I said, for two reasons. First, I did not want to be alone. She has been beside me my entire life. I did not want to be alone. And I wanted to go ahead and help her." Well, my wife said to me, while we couldn't either of us control who would go first, she had no doubt that neither of us would be alone. I write today to thank this nurse because she reminded me that once again, my wife was almost always right, and she was right in this instance. I was not alone. Thank you. And he closed the letter. I share this story with you because it is still to this day a very vivid memory of mine from one of the first times that I became aware of the enduring power of compassionate care, not just for the recipient of the care, but also for the giver of compassionate care. I can tell you for certain that I do not remember with such vivid detail the first medical resuscitation that I was in, but I have not forgotten one of these first moments of compassionate care. I hope that you have many such moments throughout your career. Now, in summary, I did say I would offer some advice, and that is, you all know that nursing is highly rewarding and a dynamic profession, but at the same time, it can be stressful. The best nurses make time for themselves. We need to strive to achieve a healthy work-life balance. Compassionate care includes you. Good self-care is important. Don't ignore your own personal needs at the expense of caring for others. So in summary, congratulations for your commitment to being champions for compassionate care. I wish you the best in your studies and your career. I share a quote from an American historian and biographer, Dr. Doris Kearns Goodwin. Doris noted, there is nothing more important in life than to have work worth doing and doing it well. I suggest to you, humanistic, compassionate care is the key to doing our work well. We indeed have work worth doing, and I am confident you will do it well. Congratulations. I wish you the very best.
Dear students, now that you have participated in the white coat ceremony, this portion of the ceremony is reserved for the completion of the Honor Code Pledge. We proudly display this pledge along our hallways at the UWF School of Nursing, where it serves as a daily reminder of our commitment to providing care with a holistic, kind, compassionate, humanistic approach, and we remember to include ethical standards first and foremost in our care. Let's take time now to recite this pledge together. You will find it on the back of your program provided for the ceremony. I join my fellow nursing students today to pledge my commitment to the highest ideal and academic standards of the education at the UWF School of Nursing. This commitment arises from the principles of honesty, integrity, accountability, confidentiality, social responsibility, and professionalism in all my written work, spoken words, actions, and interactions with patients, families, peers, faculty, and society as a whole. I pledge to exercise sound professional judgment while abiding by legal and ethical requirements, and I acknowledge my responsibility to report unethical behavior. I pledge to consider the welfare of humanity and relief of suffering my primary concerns, and I will act in a compassionate and trustworthy manner in all aspects of my profession. I pledge to work with and support my peers in the pursuit of excellence in our nursing education. I accept the lifelong obligation to improve my professional knowledge and competence. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily, with full realization of the responsibility entrusted to me by the public. Today, as I begin my nursing education, I accept the responsibilities and unique privileges of the nursing profession, and I pledge to uphold the spirit and letter of this code during my time at UWF and throughout my professional career as a registered nurse. Students, on behalf of the faculty, congratulations on making this commitment.